Once you have a dental implant, it's for lifetime. But I've seen in families after 6 years, tooth is coming out.
See, it's a force. When there is a force, multiple time eating, forces will happen. These forces will take micro movements in them.
Wisdom tooth, does it have to be removed always?
Unless until somebody is troubling you, don't trouble them. In wisdom tooth also, sometimes it is fully erupted. But if it is inside the soft tissue or the mucosa, very near to the nerve, which will get irritated and get pain.
Some people, like when they're moving their jaw, there's a tak sound.
Yes. So once this move like this out, then when the end part of the joint touches this bone, it forms click, like tuck.
Like people say in government hospitals, they don't see well.
See, I worked in government, I worked in corporate. So there is a difference in mass practice and class practice. So in corporate practice, sometimes what happens, we have specific time that we sit with the patient for an hour, we explain pre, post, everything. So even that makes a little bit of difference.
Any one habit which you will advise people to have a proper dental health?
Except water, whatever you put in mouth, go and get gargle. Best.
Okay. I was looking into your profile and I've seen that
I had an interest, so I have to read a lot of articles and I used to write a lot of articles. And then I saw in India, medical research come into 27th position. All the doctors are busy in their clinics, everybody is practicing, so they don't have time. Normal curriculum of UG and PG, we are not taught how to do a research and how to write an article and how to publish it.
Hi friends, welcome back to our podcast. I'm Dr. Vani. And in today's video, we are back with another interesting dental related podcast. The reason we do a lot of podcasts related to dental issues is because a lot of people neglect about teeth and diseases related to mouth. Through our podcast, we want to bring in awareness more about how important teeth are and how dangerous can be infections related to your mouth can be. To talk more about this topic, we have with us Dr. Rahul V.C. Tiwari. He's a consultant oral maxillofacial surgeon. Welcome to our podcast, doctor.
Thank you so much, Dr. Vani, for calling me. That was really great pleasure to come here.
Doctor, like many people think generally dentistry is more about like just teeth and everything, basic. But like when I saw your profile, it is oral maxillofacial surgeon. So what is it? Generally, this terminology looks like more of surgery kind of thing.
Correct.
So what exactly is it?
Basically, what happens is, see, normally if we do MBBS, then there will be different fields. Like person go to orthopedic, ENT. So every part has different expertise. In the same way, what happens in dentistry also, there are almost 10 departments which will having a separate expertise. In that, one is oral and maxillofacial surgeon. Like there will be oral and maxillofacial surgeon who will be dealing with the jaw, the tooth, the whole face and the head and neck also. Now the craniofacial surgery is included in maxillofacial surgery also. Like plastics does for the whole body. We take care of the face, bones and other structures related to the jaw and face. So sometimes the hypertelorism or such kind of craniofacial anomalies also we are taking care in our department nowadays. Same way, BDS has 10 departments. One is maxillofacial, then another is orthodontist who take care of the teeth, the alignment of the teeth. They put aligners and braces. Same way, there is a periodontist one department who takes care of the gums. Then pediatric dentistry who take care of only child-related teeth disorders till 12 years. Then there is oral pathology, oral medicine and radiology. So there are like that almost 10 departments. So which take care individually of these things. So when we do BDS, like Bachelor of Dental Surgery, so we take care of everything. But when a BDS cannot take care of some kind of case, then they need expertise also. In that, MDS will come into picture.
So a normal dentist and maxillofacial surgeon and all are totally different.
Yeah, they do normal extractions of the teeth, and some dentists will do some kind of courses and they operate. But when it comes to cases under GA like maxillofacial trauma, orthognathic surgery, the jaw surgeries, any tumor which happens on the face, oncosurgery, dental implants or full mouth rehabilitations, those kind of cases will be taken care by the maxillofacial people.
Okay, people should know, because normally in common public, like if they have any problem with their teeth or dental issues, they just go to a dentist.
Yes, that's
so
true.
There are, as you mentioned, there are so many specialities in dentistry and all. So they should be aware what problem ke liye, where they should go and all.
True.
So can you just tell, like in common terms, how to choose a proper
specialty?
Yeah.
So like see, 10 departments. First comes, we tell about maxillofacial. So if patient suddenly had a fall, he had a tooth fall, or he had an injury on the face, or he had a jaw fracture or anything like that, or he has an ulcer in the mouth, these kinds, it is better to visit a maxillofacial. Then if they have bleeding issues or they have gum swelling issues, in these cases they can visit a periodontist. If they have a cavity which is tooth is aching, they can, or a fracture of the tooth, then they can go to an endodontist. If they have malalignment of the tooth are not in correct place, it is front, back, something like that, then they can go for an orthodontist. If children till 12 years, they can directly go to a pedodontist for any kind of dental related issues. And then there is, if they have some oral lesions or they need some radiology, then they visit oral medicine and radiology specialist. And usually when we want to check whether any kind of pathology is there, then they can visit a oral pathologist. Oral pathologist usually will be taking care of the pathology side, so they are interlinked with us, which we will be sending them cases and then they give us the reports. Because at the end we always say that the surgeon's best friend are pathologist and radiologist. Unless and until they confirm completely, it is difficult for us. Then comes one forensic odontology. That is also one branch that is completely related to the forensics. So that is also one branch there.
Okay, forensic also.
Yeah, forensic odontology is also there. It was not there on the long back time in the history, but since recent years, this also has been included in the dentistry. So forensic odontology courses are also there. So many specialties. But usually, every dental surgeon who has completed his BDS is aware and knows everything what a dental surgeon does in all 10 specialties. So you can visit any nearby dentist, and if they can handle the case properly, it's fine. If they cannot handle, if it is beyond their expertise, then they will call a specialist and they will come and operate. Because we also go for many small clinics to operating cases which the BDS people cannot handle. Usually in many cases with experience, with some fellowships, with some courses, even BDS does most of the cases.
This is correct, because I know one of my friend, she has a clinic, and depending on the case, she calls in specialists. So whatever specialist is required for implants and anything, any fractures, dental fractures and all those things, she calls in the required specialist, and according to the specialist timings, she gives us appointment. So that is there. So I think a lot of dental doctors work in collaboration.
That's true. That's
all
true. That's why that BDS itself is called as Bachelor of Dental Surgery. It's like MBBS is called as Bachelor of Medicine and Bachelor of Surgery. So it is especially that Bachelor of Dental Surgery. So they even are equipped to do all kind of cases.
As you are a maxillofacial surgeon, so do you get a lot of cases of wisdom tooth removal and all?
Yes, we do. When it is divided into minor and major surgeries. So minor means which we operate under local anesthesia. So that can come around small stitching of some laceration, or suppose wisdom tooth extraction, normal tooth extraction, or dental large surgeries, like those things. Then comes to major surgery which we operate under general anesthesia. That can comes into onco, trauma, different kind of tumors, pathology, full mouth implant, dental implants, which is screw we tell, dental implants will be kept and full mouth teeth will be placed. Those all things come under GA. So it is divided into two different sectors. So when we go to small clinics, we do these cases under LA. When we go to major multi-specialty or super specialty hospitals, we operate cases under GA.
Regarding this wisdom tooth, a lot of people have this doubt. Like, does it have to be removed always, or we can just let it and treat it with medications?
No, I always believe unless until somebody is troubling you, don't trouble them. The same way I deal with the wisdom tooth also. But it is better to get it checked regularly, because we don't know how the wisdom tooth is there. Because in wisdom tooth also, sometimes it is fully erupted. It is into the occlusion of upper tooth. Then there is not a problem. It will never cause an issue. But if it is inside the soft tissue or the mucosa or the gums, or it is inside the bone, then sometimes there are chances that it can involve into some pathology or some tumor, or it can be very near to the nerve which will get irritated and get pain. So it is better to get it checked. If it is completely into occlusion, not interfering into anything, not pushing the other tooth, it is completely with the upper tooth aligned, then you don't have to remove. So unless and until in that case it doesn't give you trouble, you can leave it off. Otherwise, if it is giving pain or something, most cases we will prefer to remove the third molar. Because in history, if we see the Neanderthal people or the old people, thousands of years before, they used to have big jaws. They used to eat raw food. That time, those teeth are important. Like if we see the old times, our little finger was completely big. But slowly this is not much of it is getting reduced. So they say that Homo futuralis, when people will be there, they will have more little finger. The thumb and little finger will be more reduced. That is what the research says. So in that same case, after few years, there are chances that the jaw size is going to reduce much more. The wisdom tooth will be completely out of the arch.
So that is there.
The less we use, it becomes like appendix. Same
vestigial
way. Vestigial. It becomes vestigial.
And moreover, I've seen because of my age and all, my friends and all, few of them will had some complications of wisdom tooth removal. Like it was not removed properly, or after removal they had infection and
Correct.
they had to take leave from office for
Yeah.
2-3 days. Whereas in some people it was like smooth. So hearing those stories again, like people in family, elders say, don't get it removed. So why does this happen?
Basically, see, it will have a different grades. If it is, we also tell it into different grades. One is soft tissue, that means it is just inside the gums, not inside the tooth or bone. The tooth is not inside the bone, it is just inside the gums. So giving a cut in the gum, removing the tooth, putting 2 sutures, it is comfortable. You won't have much of swelling which is seen from outside. You won't have much of pain. You can go next day to your office and do your regular work. But if it is inside the bone, then it is divided into grade 4. Grade 1 means very little inside the bone. Grade 2 means in the jaw length, if it is just here on the top, it is grade 1. Here on grade 2. More deep, grade 3. If it is some other places in the bone, it can be in the ramus or very deep, then it becomes grade 4. So according to the grade, more bone we have to cut and then we have to remove a tooth. Sometimes we have to cut the tooth into pieces, and there are so many vascular structure like nerve, artery, all those things. So as inferior nerve we say, the nerve is there. So if it is very much deep into the nerve, then there are complications that the patient can have little bit of paresthesia for some days, or they can have more swelling because more bone cutting, more trauma to the tissue, more swelling. So that's why. So it depends on which kind of grade the tooth is. So even we as maxillofacial, we will completely explain the patient, okay, see, your tooth is in this much grade, we will be cutting this much of bone and soft tissue, so you will have more pain, more swelling on the coming days.
There will be some communication gap between the doctor and the
so
patient.
it is very important that before anything we explain the patient completely about the scenario, the diagnosis, the treatment plan, and what post-operative it will be till the time they heal themselves well. That's why we take a proper written consent, proper oral consent, and we explain them everything. We take signatures if it is more complicated to the patient, and then we operate our procedure and explain them as well.
There's a difference between like patient and patient and patient, like
Yeah,
how
obviously.
severe, how in-depth, as you explained,
Obviously.
very clear. Condition of the wisdom tooth
Yes.
must have been very different. That's
Yes.
why people come out in different scenarios.
Exactly. If a soft tissue who has an infection of just a tissue or a small gum, they will be very comfortable in the evening. But
Correct.
person who is into grade 3 and grade 4, it will take a week to resolve the issue. So that's why the people don't understand that. People are, I got it removed today and I was very comfortable the next day. Which doctor removed it tomorrow? You are having 1 week swelling.
Correct. This happens a lot. In that, don't go to the dentist.
Exactly.
It was like paining for so many days and all that, but they don't know like
Exactly.
their situation is totally different.
True, because every doctor wants his or her patient to be treated very comfortably. Every doctor wants it to the best. But if the scenario and the condition is different according to the grading, obviously the treatment and the post-operative complications will be different.
It is there.
Every case is not the same in all.
Age of the patient, condition of the patient,
systematic condition, BP, sugar, all those
that's
things.
what the
Diabetes people, it takes time to deal with it. If the HbA1c more than 7 or 8, we don't even do impactions which are deep. We make sure we consult to diabetologist and we reduce it to a normal condition, and then we do. If patient is a cardiac patient, we make sure we take a written consent of the cardiologist, and then we stop aspirin or clopidogrel for some days, and then we operate them. So there are scenarios. Systemic conditions do involve.
They will be having different co-associates and all those. Grade 3 and grade 4. So why do people go till that stage and come to you?
It's not like a ulcer or a tumor that it is small, then it is grade 1, it becomes big, it is grade 2, it becomes more big, it is grade 3. It's not like that. Wisdom tooth it will be inside the bone. So unless and until it put pressure on the nerve, or it gets any infection, or it puts pressure to the other tooth, which we call second molar, like the third molar ke side. So unless and until these 3 scenarios happen, the patient won't come to know that there is a trouble, because the tooth is not troubling him till then. It can be very deep, it will never give a trouble. But once that touches the nerve or the peripheral structures, then it starts creating pain. So usually third molar problems come when the patient has problem and then they come to us. Otherwise, in routine investigations, when we take a orthopantomogram or OPG or X-ray, then we come to know this is the scenario.
Okay. Because they won't feel the pain, they don't come.
Yes, and that's why we tell that it is better to visit a nearby dentist and get your oral hygiene or the tooth checked every 6 months or a year. So at least if anything is there, we will come to know beforehand and we can treat it accordingly. Okay,
so they won't be knowing that there is the impacted wisdom tooth. They say.
Even I had an impacted wisdom tooth which my professor removed. Because we are a doctor, we got it checked before only. I also get
before
it.
You
make
got the
sure
pain
that every year I will check it, and I came to know this is coming into an abrupt position. So I got it removed.
Once they get a tooth removed, especially like wisdom tooth or any tooth extraction, doctor, can you tell us 2 or 3 tips that a patient should take care of?
Most important is after tooth extraction, whether you go for a normal extraction or a surgical removal via suturing and all, like impaction which we do, don't spit for next 24 hours. Blood, saliva, whatever comes, take it inside, because spitting causes negative pressure in the mouth, and the clot which is forming there, that can dissolve and come out, so more bleeding will happen. The cotton which will be kept, bite it for at least half an hour to 45 minutes. After that, take some cool juice or ice cream, take liquid and soft diet for a day. And next day when you are brushing, don't gargle very harsh. Slowly you can just let it go. The water, let it go from the mouth. And after 24 hours, make sure you do lukewarm salt water gargles for at least 3 to 4 days. That helps a lot. Because of osmosis, as we say, it helps a lot in reducing of swelling. So these tips are very important. Nothing to bite hard, not spicy food or soda and all we should avoid. Even these things, if they take care, that is sufficient.
Yeah, sounds simple, but again, if people don't follow those tips and all,
Exactly.
it might be complicated again. They might
obviously,
get infections and all that. It might not heal properly.
Yeah, because if they don't clean it properly, it won't heal.
Delayed healing and all those things.
Exactly.
I think even for doctors, it is important to take little more time and explain how to take care of them even after the...
See, I worked in government, I worked in corporate. So there is a difference in mass practice and class practice.
Okay.
Mass practice, there are 200 patients you have to see in like span of 6 to 7 hours. You don't have that much time. So you just give a paper or just explain whatever best you can. But in corporate practice, sometimes what happens, we have specific time that we sit with the patient for an hour, we explain pre, post, everything, because we have to operate hardly 5-6 cases in a day. In government, it's not like that. There are hundreds of patients in line. So even that makes a little bit of difference.
Correct. Now, as you are mentioning, like people say in government hospitals, they don't see well. It's not that they don't see well.
Because there is
so
a
much
pressure
of
from
volume of
government.
patients,
Obviously.
like tons and tons of patients.
Exactly.
And they don't get time to explain each and everything slowly. So that's the reason like government hospitals are getting backlash these days. It's like the doctors working in government hospitals are so experienced. Even I worked in central government hospitals. They are so experienced, and the kind of knowledge they have also is immense compared to private hospitals, or it's equal. But again, as you said, this is a very good point.
Even I have an article which I published with class practice versus mass practice. What's the difference?
I think this should reach common people before backlashing government hospitals.
Yeah, and government is recruiting doctors, means obviously they will be well certified, then only they get jobs.
Yeah, and they will be working for years and years in the same department.
Exactly. Because if you have to see that scenario is only that the hospital opens from 10 to 2, 10 to 3 or 10 to 4 in major places. And in that time span, you want us to see 100 patients. Obviously, I have to divide the case. And every patient is important. It's not like the first 10 patients are important, next 10 patients are not important. Whether it's first patient or last 100 patient, they all are equal to me. So I have to divide my time to each to give the best I can. But in such time duration of minimal time, I have to give what best I can. So I have to divide that time very specifically. I cannot sit for an hour to explain everything. So as per the situation, we have to practice.
Because of lack of time of doctors, we cannot blame the government doctors that they're not seeing well and they're not very caring and all those things.
It's not like that. The population is a major problem.
Yeah, people think like they're getting checked for free. That's why they're not getting treated well. It's also
completely
another
wrong.
myth people are getting, because like when I was not feeling well at some point of time, I visited a lot of private doctors and all those things, and last May I went to NIMS. Before working in NIMS, I went to NIMS and I checked myself with government doctors and all, because I know they are the best where I can get the best treatment. Government hospitals have the best of best doctors.
Exactly.
And moreover, doctor, these days a lot of people are having jaw problems. So why do you think like these kind of jaw problems are occurring these days?
Actually, see, first and foremost is our food habitats. Second is very important is stress. In lifetimes, this life schedule or lifestyle what people are living, they eat lot of food which actually are not correct. Previously used to eat more of fibers. Now we eat more of sticky foods. So those even cause toothaches. And then because of genetics, there are so much cases because of different genes mutations. The cancer cases are increasing. The jaw deformities are increasing. Even in India, I worked in Kerala. If you see, the jaw deformities, like we see the jaw is more front, jaw is more back. So these cases are very much in Kerala. In the Kerala population, they have bimax cases. The jaw are more bigger comparatively. So it is like that. But if you go to northeast side, they have small jaws, if you see them. So even these are related to directly to genes and chromosomes. So it's not only about the food habitats, but it also about the genetics which is there. Now even if IHC and all, when we do for cancer cases, we see there are different type of gene mutations because of which the cancers are occurring. So that is also there. First is food habitats, then
Genes.
stress. Because stress, what happens? Again, there are so many chemical mediators which release. Then stress causes muscle cramps. They do bruxism, grinding of teeth. All those things again related to temporomandibular joint problems, jaw problems, jaw deficiencies. Now, cancer, though, obviously, it is like eating tobacco, this nuts, betel nuts, all those things. So every case depends.
And you mentioned grinding of teeth. Is that a problem, grinding of teeth?
Because the tooth also is made with different layers. First is the enamel, the white layer. That is the protection. That is made up of calcium. Then comes your dentin, which is the soft layer. So once the enamel is eroded, dentin comes, that is sensitive because dentin contains the nerve ending. Then comes your pulp. Pulp is the main area where all the nerves and vessels of the tooth will be there. So once it reaches there, the sensitivity increases to pain. After pulp, then goes to your root area and down. So in crown part of the upper part, what we see, it's like that. It is like a tree only. It has roots and it has the tree outside.
Multiple
the crown
layers.
is multiple layers. So this is what is important. Once grinding happens, what happens in grinding? The tooth is grinding. So obviously the enamel layer lost slowly in time, and the dentin comes out. So once dentin comes out, we can see that the tooth are looking more yellow rather than the enamel, and they becomes flat. If we see, the tooth is having cusp, but once these cusps are gone, the tooth becomes flat. So we can see directly in mirror also, and we can see our tooth are getting flattened, and we can see more of white on the corner and yellow in the between. So that becomes sensitive. So when they take cold food or hot food, then it becomes more sensitive. When they brush harsh, they can feel that there is a sensitivity. There is a difference between sensitivity and pain.
There is a difference between sensitivity and pain.
Yeah, sensitivity means they will feel, in Telugu we tell jumlane feel like that. That is what is sensitivity. Pain and noppi. So there is a difference in these both.
Both are, they have to be alert and visit.
Yes, sensitivity will be related to a localized lesion, but when it happens pain, pain will radiate towards the ear, towards the joint, towards the jaw, towards down, because there is only one nerve which supplies like this to all the teeth, and one nerve comes from here to supply all the teeth. From both sides there are two nerves which are coming, what you call trigeminal branch mandibular nerve. So that is how it is. So if it is touching the nerve, it will radiate to all the positions where nerve is roaming. But when it touches the nerve endings from the dentin, the pain will be literally little bit of localized. So you can understand the difference between sensitivity and pain.
Sensitivity and pain. If anybody is experiencing sensitivity or pain, they have to visit a dentist. Obviously and to get it treated. Rather, otherwise it will lead to much more serious
because
problems.
Sensitivity is at the end will lead to pain only. Whether it's a cavity or it's just erosion of the teeth. In both the scenarios,
sensitivity is little bearable because like only when you are eating cold and all, it will happen. So people will postpone it, but dental pain is unbearable. You just can't bear it.
And see, when for example a cavity is there, if it is reaching enamel, there will be very less cement which needs to be filled, so your charges will be less. When it goes to dentin, there will be more cement and layered cement which we will keep. We keep a calcium hydroxide dressing to take care that the dentin is safe. Then we put another layer of composite or GIC and then we fill. And when it is reaching more deep, like touching the pulp, we have to go for a root canal. So root canal, again you have to put a crown on that. So if you are if you are checking it, getting it checked and getting it treated in early stage, you are also comfortable, you have to spend less finances also. In both way, it is better to the patient.
Like a lot of people tend to neglect baad mein, like we'll go later. But again, they come at the very latest stage and they have to spend more money and there is no insurance also. You're not taking early initiatives to visit a dentist.
Correct.
So people have to like make it like how they do every yearly health screenings. They should do dental checkup regularly.
And so many clinics or so many corporate hospitals are there. They will give different plans also, like dental health plans and all, in which every year you just have to pay this much amount and your checkups are included in that. So that is also comfortable. There are hospitals nowadays, corporate hospitals who take care of all those things, and even clinics also they will give like that, because it's not like that if you are visiting every time they charge. If you are, for example, a root canal takes 3-4 sittings sometimes with a crown. So in those sittings they are not going to charge you.
While you were talking about jaw problems and all, you also mentioned about this stress. So because is there any link between like a person having too much stress in their lives and it is shown as jaw pain?
What happens is, see, stress releases some chemical mediators in the body that directly have an effect on the muscle. So these muscle get spasm or cramps.
Mm.
Very little, in a very little mode. So even our masseter muscle, which is there, which is responsible for our jaw movements, the main muscle, so that also have these, when it takes that chemical mediators, so they will have sudden movements. So these movements, excessive movements of the muscle will obviously have pain. If you go to gym, if you're doing more gym,
Correct,
obviously you will have a pain in the evening.
Yeah.
The same way, the masseter muscle, which takes care of our jaw movement, our food, if it has more movements, what will happen? It will indirectly lead to muscle pain. We call it masseter muscle hypertrophy also, the increase in the size of the muscle if it works more. And because of that, because jaw is linked, jaw has a tooth. So tooth will automatically grind. So this will lead to bruxism. The grinding of the teeth. Grinding of the teeth, what will happen? Because jaw is a single bone. So both the joints will have more force towards each other. So these joints will have a pain. So it will lead to temporomandibular joint problems, joint pain, clicking of the sound. So all are interrelated.
Okay.
And I always tell my patient, why do you take a stress? Because you are not able to solve a problem. If you know the solution, just go for it and solve it. And when you know there is no solution, what is the point of thinking of that problem? Just let it go. Be happy all the time. Stress taking is not a solution for anything. It is going to worsen your health. Even I believe in my life, I don't take stress much. होना है तो होगा, नहीं होना है तो सोचना क्यों है? Why do worry? Let it go.
Gaur Gopal Das quotes this same quotation.
Even I follow that in my life.
Okay.
See, God has given me life one time. This second, once it went, it is not going to come back. So try to be happy every second. Because once you are happy, automatically many problems get solved automatically.
So, and doctor, like you mentioned excessive movement of the jaw. Is it a good thing or bad thing? Because why I'm asking is this, because sometimes people, I read somewhere, like you have to chew more to make your muscles of mastication more stronger. So that's why, like if you see celebrities and all, they will be chewing on chewing gums and all.
Correct.
It can be for better breath, but also I've heard that there is a scientific reason which is good for us, that if you keep on chewing, because we are not eating much of raw fruits and all, and we are tuned to eat more of raw fruits and all those things. It's better to chew food. You mentioned like excess chewing might cause jaw pains.
See, there is one thing which is voluntary, which is under our control. Then there is something called as involuntary, which is not in our control. Breathing normally is fine, but you knowingly want to breathe extra, then it creates trouble, no? Because you will obviously have some differences. Same way, when voluntarily you are using chewing gums to make your masseter muscles okay and comfortable, it's fine. But these things, stress, cause involuntary movements, which is not at all in our control. So it happens very excessive. Like I gave an example of gym. If you know that you can do only 20 biceps in a day, for example, you want to do 200, obviously you will have trouble with your muscles in the evening or next day. So same way, whatever is comfortable. Once we are chewing chewing gum, we came to know that now my jaw is going to pain, you just leave it off. If you are comfortable, you do. And they also don't use it for 24 hours. We see celebrities only when they are doing. And they also do when they are in camera. When they are sitting at home, they don't do that. So it's like that. In our body, whatever we do, voluntarily when we are doing, we come to know that our body is adapted to this, and beyond this, I'm not able to do. So don't touch it when it's beyond. Our body is also a social machine.
Jaw clicking also. So some people like normally when they're just talking or something, like when they're moving their jaw, there's a tak sound. So is it abnormal or is it normal?
Jaw clicking, I cannot say it's normal or abnormal, because jaw clicking means there is some kind of problem in the joint. That's why there is a click. But normal click is okay. What happens is, see, our skull is there. So there is a glenoid. And then our joint is there. So when we move, the joint also move like this here, the TMJ, what we tell. So once this move like this out, then when the end part of the joint touches this bone, it forms click, like tuck. So when we open and close, it becomes tuck. So normally there is a synovial fluid inside. So once it is moving smooth, it's fine. But when there is some, even in BREXSISM, the tooth gets veered off. So what happens? The jaw size gets reduced. So the joint goes and touches the glenoid. So if touches like this, obviously when it moves, it will create sound. Now this clicking can increase more. So if you feel the clicking is increasing more, there is some kind of pathology or some kind of internal dearrangement in the joint which is causing this. Then it is obviously better to get it checked.
Once a while,
clicking, it is always better to get it checked, because you don't know how severe it can be. If it is not severe, we take OPG or we take temporomandibular joint tomography in open and closed space. So if it is, we can see and understand if it is not creating much trouble, well and good. But if we see that there is a pathology or there is a reduced joint space or something, then it is better to get it checked. There is no wrong in getting it checked. Whether it is any part of the body, it's not about over maxillofacial or dental. Any part of the body, when you come to know that your body is not responding properly according to normal, better to get it checked. Don't delay. If it is normal, it's fine, because diagnosis doesn't take much money. In hardly 500 or 1000, every type of x-rays will be done.
Facial fractures, I think that's your
expertise.
So like facial fractures sometimes like can they be left alone, self-healing and all?
Obviously. If in case it is just a hairline fracture, sometimes what happens, even in surgery we see, like there are different kinds of fracture. There will be lower jaw fracture, upper jaw fracture, and there will be face fracture. Upper jaw also is divided into 1, 2, 3. If it is just fracturing here, 1. If it is fracturing here, 2. If it is fractured from here, it is 3. So like that it is divided. Then condyle fracture, body fracture, ramus fracture. As per the name or the part of the jaw, it is fracture is different. Now, when the fracture is in the line, it is not moved at all, and our occlusion is completely fine how it was before and now. Many a times we will not touch the case.
So healing, self-healing.
Yes, we can. Only thing is, in lower jaw, even it is fractured and it is not moved, it is preferable to plate it or fix it with wires or plates, depend on the situation, because lower jaw is completely mobile. In the whole face, only this lower jaw is mobile, so it helps in food. So there are chances that if it is not displaced, while eating it can displace because of pressure, but upper jaw it might not, because it is fixed. So in that case, lower jaw in any kind of fracture we will prefer to plate, unless and until, see, jaw is also like this. Inside your tooth is there, the lower jaw we say. So if it is only single line, we can see in CT. If it is single line, that means back side or lingual side of the tongue side of the bone is completely intact, we can leave it. If we see there is a hairline fracture but both sides are involved, because of some due reasons it is not moved, then it is better to get it fixed. So it's like that. If it is displaced, the bones are not in the continuity, then it is better to fix. If it is in continuity, in some cases we can leave, but not in the lower jaw. Lower jaw fracture, if it is single side, no fixation, both sides, it is better to fix. Whether it is moved or not moved, that's okay.
Depending on the position of fracture.
As I said, every case is different. So every case scenario is different. And even see, in childhood, there are fractures. In pediatric fractures, when we were working in medical college in Kerala, there was a case of 3-year-old child. They were from a poor background. So what happened? The baby was sleeping in the floor only, and there was a wall. The wall fell on him. So he was having a complete craniofacial fracture. The upper jaw, lower jaw, his mandible jaw, then his head, everything was fractured. But you cannot plate that case. And there was a new neurosurgery side clearance also. At the end, the patient, we tried, but it didn't survive. The baby didn't survive. So there are scenario to scenario. It depends how condition it is. There was a case of a pregnant lady. They were going for their in-laws house or something like that. The car toppled. So, and she was in her 8-month pregnancy. So in that same OT, there was a plan that the baby needs to be delivered. She was having a jaw fracture. She was having a femur fracture of the leg. So the orthopedic has to operate. We have to operate. Gynec has to operate. And plastics also have to operate, because there was little crush. So these all scenarios we have to take care, and we have to operate together. So multidisciplinary approach also needs important sometimes. It all depends upon case to case.
So in multi-speciality hospitals, even a dental surgeon also is there.
Yeah, because I was attached to Omni, I was attached to Andhra hospitals, I was attached to an orthopedic hospital. Many hospitals have kept a dental wing also. So there will be a dentist and there will be a maxillofacial attached. So any such kind of cases happens, it comes. And what happens, the face is a structure where ENT also comes, orthopedics also come, plastics also come, maxillofacial also come, general surgeons also do come. It depends upon their expertise, whoever can operate what they operate.
So even an ENT surgeon comes in this scenario where you explained.
Only difference what happens is, when it comes to tooth and jaw, this particular subject is not in vast when it comes to plastics or orthopedics. So when it comes to tooth and occlusion, that setup education system is not there in these kind of specialties. So when it comes to occlusion correction with jaw fractures or in tumor, we come into picture. And nowadays, like maxillofacial also has become more super specialty. Previously there was only maxillofacial. Now in our AOMSI, our association also, they have different fellowships. There is a fellowship for trauma, there is a fellowship for full mouth dental implant, there is fellowship for aesthetic surgeries, there is fellowship for TMJ, there is fellowship for orthognathic surgery, there is fellowship for cleft surgeries. So there is so much to do. So now there are super specialties also in maxillofacial.
So dentists have a lot of scope.
Lot of
Yeah,
scope.
yeah.
See-
whichever narrow, they can have a proper niche area, whichever they are interested. Like
yes.
cleft, corrections also is very common in India.
Very common in India.
very
There is a
common.
smile train which is there. They do
Yes.
free cleft surgeries and all.
Yes,
Because when I
yes.
worked in Kerala, it was Charles Pinto Cleft Center. So that is very famous.
Mm-hmm.
It is one of the famous institute in India.
Okay, so you do cleft.
I used to take care of hard tissue. Soft tissues will be done by another team. I used to be in hard tissue, but
ENT
we learned
surgeon.
both.
Yeah.
But my expertise and my interest was on hard tissue operating
Okay.
procedure.
And as you are telling, like aesthetic process. So these days, a lot of celebrities are doing this jaw correction, cosmetic. How common it is in Hyderabad?
In Hyderabad, there it is common because this reason is now this internet media, everybody want to look better. So now people themselves are feeling that my nose is not correct, or my smile is not correct, my eye are not correct. Am I looking more beautiful or not? Can I look that way? Can I look this way? So these patient psychology itself is creating an awareness about the aesthetic procedures. And in aesthetics also there is soft tissue, hard tissue, like the skin or the muscles and the bone. So there are cases when the jaw is completely deformative, then we do bone correction. When we see only there is related to skin, then soft tissue procedures are done. This Botox, fillers, these all are soft tissue procedures. When it comes to orthognathic surgery, jaw corrections, completely movement of jaw, then it comes into hard tissue procedures.
Tissue. They are safe.
They are safe. Yeah.
No
It's like in
complications.
foreign, it is very frequently practiced.
Common.
In India, it is emerging, but even then in India, there are so
quite
many.
safe. And,
it is safe. It is safe.
And does it do a difference as such to the face?
It's not like, see, aging is a process which nobody can stop. So it's not like that if you have got a Botox done today, it is going to stay for next 10 years. Down the line, obviously the face wrinkles and all will happen. People undergo for facelifts. They get facelifts and stretch their skin, and we tie it on the back side of the ear so no suture marks are there. So we do facelifts. But ऐसा नहीं कि facelifts करवा लिए तो after like 10-15 years or 20 years down the line my face will be same. It might need a re-procedure also because with aging wrinkles will happen. Darkening of the eyes will happen if you don't take care of your skin.
There is good improvement.
Yeah.
But again, it needs in between they have to come for again treatments and all those.
Only
things.
thing is get your procedure done from a specialist who is trained in that particular thing. I see a lot of people giving education and giving different treatments who are not actually qualified, who are not doctors, and they don't have that expertise also. So never jump on that kind of scenario. A person who has not learned hair implanter, then going to getting a hair implant done is not acceptable.
Like you go to a non-qualified person and you complain that it didn't work out. And it's very important to take time for doing research.
And that creates a wrong impression upon the doctors who are actually into that expertise.
Correct. Generalized. It will become a generalized thing.
Exactly. And obviously people know that if I have a ear pain, I have to go to ENT. I am having a problem in my eye, they go to an ophthalmologist. So same way, when you come to know that I have a problem with my jaw, go to a specialist who deals with jaw. If you know that you have a problem with gums, you go to a specialist, go to periodontist who deals with gums. If you have a tooth pain, if you know, you go to general dentist. Or if you have a tooth pain, if you know that endodontist deals with RCT and my tooth is so much paining, you go to nearby endodontist. It's like that.
I think people are not aware. Like, they are aware like there is a cardiologist, endocrinologist, nephrologist and all. But dental mein, like they don't know there are so much specific specialties. So now I think they can ask ChatGPT and tell like tooth pain, which specialty I can go, not the treatment.
Exactly.
But for tooth pain, like for jaw pain, for jaw issues and all, they can just ask ChatGPT and get their answer which specialist.
And even if they don't get an answer, it is better to visit a dentist nearby. They will help you out.
Doctor, this jaw correction, as we are talking, is it only for, like, there is one part for cosmetic purposes. So does it help in, chewing? I heard that it will help in breathing issues also.
See, what happens, as we know our anatomy, so there is a trachea or the windpipe we say. So if your lower jaw or upper jaw is back, so automatically the tongue goes back and the windpipe which is there, that gets constricted. So once your jaw is in correct position, the windpipe is in correct size. This will help in speech proper breathing. If it is not there, that lead to obstructive sleep apnea. Because when we sleep, automatically due to gravity, our tongue and the pharynx, which we say, fall back. So the airway, if it is already constricted, it will constrict more. So in between our sleep, we will have apnea. That means we won't be able to breathe properly. Then suddenly we have to get up, we have to sit, and we have to take deep breath. So once your jaw is in correct position, the windpipe is correct. So obviously our speech also comes because we have vocal cords, and with the air only that sound is coming. So if the vocal cords are also in correct position, the windpipe is correct, automatically the speech will also be correct. So function is also a very, very important part. When we operate cleft orthognathics, because of cleft, the hypoplasia, what we tell, the jaw is not correct, or in cleft is there. So in these cases also, there are a lot of cases like this in which function is the more important thing rather than aesthetics.
Okay.
See, as a doctor, we see function. As a patient, they see aesthetics.
Correct.
So in cleft and orthognathics, when we operate, both the things are operated. We take care of function, they take care of aesthetics, but indirectly we get benefit that we are treating aesthetics also, and they get benefit because function is also altered. There is a very important fact of function. Yes. The people who have obstructive sleep apnea, speech abnormalities, in many cases, jaw correction has helped them a lot.
Yeah, I was about to ask this obstructive sleep apnea. So
Okay.
people having sleep apnea, they if they get this jaw correction done, it will be solved.
It will be solved, and it depends on what kind of grade it is again. Obstructive
And the
sleep
root
apnea
cause
also
of
has a lot of grades.
And the root cause of sleep apnea also, because
Yeah.
it can be due to some heart problem or lung problem.
It can be.
Not wrong.
It can be. So diagnosis again. Better to get it checked why it is happening and get it treated, the main etiologic factor why it is happening. So according to that, it will differ. And there are some appliances also. Like there will be mandibular advancement appliance, which is used for this kind of jaw correction. There is tongue appliances which are helping the tongue to keep it front, jaw corrected appliance. So usually orthopedics or in maxillofacial also, in dental departments, we prepare that appliance and we will give it to patient. For jaw, we use these distractions in orthopedic surgeries. We see the jaw bone is less. So we cut the bone, we put a retractor, we put a key, we keep it round every day, and the jaw length increases.
Okay.
So that kind of surgeries are also very frequently done in maxillofacial.
Oh, okay.
We have small retractors. Orthopedic have big retractors.
Jaw corrections and all, and these appliances, as you mentioned, does it help for snoring problems also?
Yeah, because obstructive sleep apnea, snoring will happen many times.
Okay.
Because snoring has many grades. So because the windpipe is getting less, then the wind which is coming from the nose going again back to lungs, there is in the pharynx area, whether it is nasopharynx or whichever area of the pharynx or the windpipe which we say, so there is a constriction. So when constriction is there, the air will not pass very frequently. It's simple. If there is a pipe, the water is coming. That water is coming in a normal fashion. And once you put thumb or finger in the pipe, then you see there will be a sound. There will be a force. The same thing happened with our pipe of wind and air.
Okay.
So because of this thing, the flapping of cords will happen. This causes that sound.
Snoring.
So the nose also will flapper. So that causes sound. That is what is snoring. Many cases, throat will be fine. The windpipe will be fine. But there will be a deviated septum. The septum is deviated. So when it is straight, the nose, this hole is fine, this hole is fine. Now, what happens when there is a deviated nasal septum like this? So obviously, if we see from this angle, there is a constriction here, but there is a more gap here. So this constriction area, again, they will stick to each other because nasal mucosa is very wet. So they will stick. So again, when the wind passes, they will make sound. This is snoring.
This dental appliances can help to some extent. To some extent.
But deviated nasal septum, you have to go for surgery.
Yeah, deep underlying structural problem hai to, then they have to get it corrected.
Yes, they have to get it corrected. All depends on grades. Which kind of grade it is.
And doctor, can you tell 3 dental mistakes that normal people should not avoid or miss?
First and foremost is, if you are having bleeding gums, when you brush or you feel that the gums are bleeding, if you see normally in a mirror, you see that the gums are swollen or that is bleeding, or you feel a bad breath, these things you should not avoid. There is some problem, that's why it is happening. Not like when you wake up, obviously there will be a bad breath. After brushing out the full day, you feel there is a halitosis, we call it, the bad breath. Then you should take care of the bad breath. If you feel that your teeth are sensitive or there is a black mark or a cavity somewhere, you should not ignore it. This is second most important point. Then if you have pain anywhere or a sensitive anywhere, then you should not avoid these things. So these as you asked three, I can tell most important three.
Yeah.
Common
So what
something.
does that indicate? Black stains?
Black mark is there. That means there is some cavity which is forming.
Oh, inside, like you
Inside the
remember
tooth.
premolar, molar.
Yeah, anywhere, not only in the front tooth also people will have sometimes black. Any body part, whether it is tooth or jaw or skin, any body part, it's your body, what God has given to you normally. If you see any abnormality anywhere, get it checked. There is no other alternate option for that.
As simple as
If
that.
you see in his skin there is a mark which has become, let it check. No, what's the problem? Why do you feel that ho jayega, theek, it will happen? How it will happen? Why do you think something will happen automatically? Nothing happens automatically. If that has happened, there will be some kind of pathology which is inside. So better get it checked. The problem in India is over-counter medicine. Anything happens, I am feeling fever, go to a pharmacy, get the medicines. In foreign, without prescription they go and get medicine, but in India over counter medicines is very common. कुछ भी हुआ उधर जाओ, ये हो गया, ले लो दवाई pharmacy से. अरे, you are spending anyhow. The pharmacy also will be giving you medicine of 200, no? Rather than go to a doctor, go to government hospital and get it checked. Big deal. If you don't have money, if you have money, better to go to a good practitioner and get it checked if you can pay. Anyway, it's comfortable, but get it checked via a doctor and get the medicine according to that.
Yeah. And doctor, like any one habit which you will advise people to have a proper dental health?
Actually, even I follow. Whenever we eat or drink something, except water in the mouth, go and gargle with water. Simple logic. Anything you put in mouth, whether it is solid, liquid, semi-solid, except water, because water itself is cleaning. Except water, whatever you put in mouth, go and get gargle. That one advice is best to solve many problems. Brush twice a day. Brush twice a day. Before sleeping, brush your. Because if anything is there which is thick, it will help you not to form a cavity or a gum issues in a later stage.
Yeah. Even children has to brush twice. For them, it's more important.
Yeah,
like anyone.
Obviously, anyone.
Just
Whether it is children or aged or old or whatever. Unless and until you have a teeth in mouth, brush twicely. And if you are wearing a denture, then clean denture.
Suppose if they are too lazy to brush at night, can they just gargle with mouthwashes?
Mouthwashes usually I don't advise. Even in my regular practice, because there are studies which prove that long-term mouthwashes can cause stains. It is better to use saltwater gargles if they want.
That is better.
Home remedy. Best. Very good.
So
but normal water gargle is also fine.
Okay.
Clean your mouth.
Like even if you don't have a space to spit out the water, you can just gargle and drink it.
Yeah, big deal.
Like you just
anyhow, it's your own
food particles which are stick
that
because
will
our Indian food has a lot of sticky particles.
Correct.
So you just gargle and swallow it. If you don't have a place to spit it out or anything. Even I learned that there is a lot of advantages of doing that.
Correct.
Yeah.
Correct.
Throughout the day.
Throughout the day. It is good. So that is very important.
Yeah. A lot of dentists are marketing it as like permanent. Once you have a dental implant, it's for lifetime. But I've seen in families like after 5 years, after 6 years, the tooth is coming out. So why is it happening like that?
See, what happens, dental implant, see there is two things. One is implant, which is a screw which goes in the mouth, and then there is a cap on top of the implant, on that screw. It's a two-piece system. So there is an implant, and in implant also there are variety of options. If your bone is good, the dentist will go for an endo-osseous implant. That means the implant will be kept. After 3-4 months we will place a cap. If your bone quality is not that good, they will go for single piece implant. That means they put a screw and directly after few days they will put a cap. But for full mouth, when the bone quality is not good, it won't be in one area. Usually there will be lot of areas. So in that cases, when we go for full mouth, they will use single pieces implant and they put more implants, like 10 on the top, 10 on the down, and then we put caps. This is full mouth. When we go for single replacements, we will use endo-osseous implants. And in many cases in full mouth also, if bone is good, we use endo-osseous implants also and we place it. But cap will be given later. In that, we will use fixed dentures also. We will make denture and we will fix it. So there are different types of scenario, different kinds of cases. It all depends upon the quality of the bone of a patient, and then we decide which implant we have to go for. Now a patient who has osteoporosis, the problem with the bone, melting of bone, or an arthritis, in that cases not necessarily we will go with single. So it depends on patient to patient how their systematic condition is. As per that we decide implants. Next, your question was why it get loosened. See, it's a force. So obviously when there is a screw type implant, when we place implant on top of that, we place a crown. So kya hota hai? Crown also will be fixed with some screw inside. We call it abutment touching both. So when there is a force, multiple time eating backside especially, forces will happen. These forces will make micro movements in there. So these micro movements after years it can become loosened, but it is not a problem. We can just screw it again.
Same thing.
It is just like the females who wear this bands. Now there will be screw.
Yeah.
And if it gets loosened, you tighten it, screw again. Go to a dentist. If they will just tighten it. Big deal. That's it. It is not to worry that I kept and the crown got loosened. With micro movement and micro forces, it will get loosened in with time. But they will fix it again. Patient should be aware of all the scenario what he or she has. The doctor must explain everything. I usually take a lot of time to talk with my patient.
That is very important.
And I take consent. Whatever I am doing, that's very important, because tomorrow you don't know, something happens, they will not understand, and after 2 years if they might forget, they will put a legal case on you. Don't take it. So it's better that do proper consent and then explain everything. Communication. That's very important. In anything, whether it's your practice, whether it's your business, whether it's normal thing also, a communication which makes a lot of difference. Even relationships, good communication is important in relationships.
Miscommunication is so common these days, like especially like it's better, like rather than typing something, if you type something to somebody,
correct,
and you mean something and they will take something else. Rather than that, just call them and tell them, and
or send them a voice message.
Because like you will be in a different mood, you'll just type 1 or 2 words and they will think like she's too arrogant or she's too careless or something. So as you said, communication is very important.
It's because of time. We don't have time. We are busy. Everybody is busy in their life. So the time difference makes a problem. They want to finish everything faster.
And this dental implants also, after placing the dental implants, I think there are certain foods some people should avoid or something, because chewing gums and all those things should be avoided.
Chewing gums, what happens? They will stick, no? So they will try to pull. So that's why they avoid to use chewing gum, and they should avoid hard foods. They should not break walnuts. They should not use sugar cane or bone, who are non-veg eaters, like that. Because see, natural is natural and artificial is artificial. Whatever God has given is different, and whatever we make is different. And the main reason it's not like about God cutting and artificial is correct. What happens? Our natural tooth has nerves. So that nerves understand when you bite hard, there will be pain. So you understand that this is my out of control. I should not bite hard. But in your artificial teeth, there are no nerves inside. So the tooth is either there will be root canal treated and you have a cap, then already the tooth is that it is just holding as a support. Either if you have an implant, the implant is getting osseointegrated with bone, but not with the nerves so frequently. So when you bite, you don't understand how much amount of force I am keeping, because our jaw can bear 650 Newton of force. So you don't know how much Newton of force you are putting to that particular tooth. So if you put more pressure, it will break. Because you will be thinking, oh, I am not having pain, I can break the walnut happily. But the walnut is creating so much of pressure that the tooth cannot bear. So it will break.
This is very, very important. Like a dental implant does not have nerve connection.
Exactly.
So you don't understand like what you're biting is not suitable for your teeth to bite it.
Correct. So, when we have artificial teeth in the mouth or artificial thing in the mouth, we should be extra careful with that. Even with the removable dentures or the front zirconium or the aesthetic crowns, they will put polishings or something. They will put veneers. That will be just like a cap on a tooth, white side. So kya hota hai? They are very delicate. You cannot bite an apple with that. They are looking tooth. They are not eating tooth. So you cut the apple into pieces and then you eat with the backside tooth slowly. Big deal. The more we care, the more better it will be caring us. I can say like that.
Yeah, because like one of my friends, she's a dentist, she told me like after root canal cap and all, if the cap is coming out and all, maybe like they might be eating chewing gums and all those things, and so it's better not to eat, because nobody tells us after a treatment. And once it comes out, then they will ask the questions like what you ate, what you did. And then chewing gums, and so chewing gums are not allowed if you have
chewing gums.
Better
not to use chewing gums or hard foods.
Hard foods are also.
If anything you have to eat, break it into small pieces and eat preferably with the, if you have one side cap, other side there is no cap, matlab crown we say, you prefer to take the big bite from the other side,
which is natural teeth.
Natural teeth. The natural teeth will have nerves. You will understand how much force you are putting.
You can
estimate.
You can estimate. And moreover, this oral cancer, doctor, like it is one of the most common cancers in India or in the
Correct.
world.
Correct.
But a lot of people misdiagnosing oral cancer. Why is it so lately diagnosed? And when you go to a doctor, what happens is doctor checks your mouth first. They put a torch inside your mouth and they check your mouth. But still, again, oral cancer is very lately diagnosed. Why do you think so?
See, the main important thing is any cancer, the starting phase will be an ulcer. Ulcer. If the ulcer is healed, well and good. If it is a non-healed ulcer, as per the classification, if it is a non-healed ulcer, the ulcer is not healing, then it can lead to cancer. Now, cancer also, there will be soft tissue, hard tissue. If it is a bone cancer, you won't come to know from outside. If it is a soft tissue cancer, you can come to know that there is a small ulcer. Abhi, what happens many a times in Indian scenario, patient only feel that ulcer is there, yeah, it will automatically heal, because ulcer happens very commonly. I used to have ulcer before exam because of tension. It happens. The after ulcer we call it.
Yes.
If we eat something hot, there can be an ulcer.
Can be B2B.
While biting our food, if by mistake tongue or some part of the cheek comes in between the tooth, it gets cut, it can cause an ulcer. But it will heal. So ulcer is very regularly done. So people avoid. Ki ulcer hi to hua hai, theek ho jayega. Now what happens? They will avoid this for a month or so. They will feel nahi heal ho raha hai, then they will reach. So by that time there are possibilities. Then it can lead to grade 1, grade 2, or might be it has already increased deep. An ulcer which is non-healing, a ulcer which is bleeding much, it is better to get it checked. I always tell, if you have any abnormality in the mouth, you are anyhow going to take a medicine from the pharmacy. Rather go to a doctor and get it checked and then take medicine. Don't take risk with your life. Otherwise later you have to pay more and you have to suffer more. Yes. Guaranteed.
And lifestyle will be hampered.
Obviously.
Everything. Like
and anybody in the family gets problem, the whole family get disturbed.
Correct.
Psychological disturbance, mental disturbance, financial disturbance, everything happens just because of one mistake of avoidance.
Negligence.
Exactly.
And delayed.
If you take negligence, tomorrow you will have due negligence.
And regarding cosmetic dentistry, do you think it is over marketed these days? Because whenever you open Instagram and all, like you see so many ads related to cosmetic dentistry. So do you think it is over marketed? Do people need? I think I feel people don't need so much of cosmetic. Dentistry treatments.
It's not overrated. I always say it is demand and supply mechanism, because people want to get it done.
Because they are marketed.
I
feel it is marketed to them. That's why people want to get it done.
That is also true. But this all happens because of this media. Everybody want to be in the Instagram. Everybody want to keep reels. Everybody want to come into face. It's like that. So they know that I have to look good. So they want ki mera tooth ekdam sahi rehna like that. That feeling they have. So because of that, obviously the demand is increasing, and because demand is increasing, aesthetics are money making business. See, as a doctor, every doctor wants the function to be treated first, and then the aesthetics is concerned. But patient want aesthetic first, as I told. So because the demand is increasing, that way the doctor have to treat, because we are expertise with that. Plastic surgeons, aesthetic dentist, or a cosmetic surgeon are expertise to do that. So we will do if patient is asking us to do.
Okay, it's like chicken and egg problem. We feel we are marketed more of these implants and all these cosmetic veneers and all these things. But the specialists like you are telling, like patients are asking.
Yeah, patient does ask. See, we cannot routinely diagnose a aesthetic thing usually unless and until it is very much troublesome. For example, a patient had an accident, he had a suture and there is a mark. This is causing an aesthetic concern. If patient want to get it treated, we will treat it, obviously. But it is not causing some functional issues unless and until they are into a field where they need to show their face most of the time. They are not into media.
Correct.
Now if patient is having a black mark, so socially they might not feel well. This orthodontic surgery and cosmetic surgeries, we in our normal nomenclature, we call this marriage surgeries. Many time before marriages, males and females will come. Sir, I'm not looking good, because of that marriage is not happening. Whatever best you can do, please do it. So it's like I don't have any stick that I can do like that. And see, you are looking like the hero or heroine. There are some things which needs to be done in a timeline. You cannot do it in a day or like 3 months. There is timeline. And I always feel that patient can ask. They don't understand the scenario which is beneath that. I always prefer, unless and until it is extremely required to put a blade in a patient, don't put a blade. जब उतनी जरूरत नहीं है तो मत करो. Why unnecessarily? God has made you, na.
Yeah.
So it's like that. So sometimes we will also explain patients कि अरे that much is not needed. But even then, if they force, again we will take consent, proper video consent, and then we touch. I being a max fax, I always believe in my thing कि जो मुझे नहीं आता ना मैं उसको टच नहीं करता. Unnecessarily doing show off, I don't know this, even then I can do this, I can do that करके if we jump into that, you are going to land up in a trouble tomorrow.
Correct.
Mark my words.
Correct.
Stand. तो जो आता है वो करो, जो नहीं आता है मत टच करो. They are expertise. For example, if I don't know some kind of surgery of face and I know my friend or my colleague who is a better expertise in that, I don't touch temporomandibular joint surgeries or oncosurgery. I am good with maxillofacial pathology and maxillofacial trauma or the minor surgery. So when I don't touch that, I refer the patient to someone who is best in TMJ. I refer to someone who is best in onco. Everybody cannot do everything. Correct. We can do, but we cannot do it to a threshold level.
Yeah. Earlier days there was shortage of specialists, shortage of doctors.
तो सब करते थे.
So whichever doctor you went, he tried to do everything.
Exactly.
But now there's so much availability of doctors everywhere, every specialty. And also just refer to your friend or senior or junior.
Exactly.
You are doing actually.
And that is how we should practice.
Yeah. Rather than being greedy for patient came and I'll make so much money and rather than operating on them, just operate what you are specialized in.
Even we do that specialized practice also, no, we can make our susceptible income for our family. It's not like that.
That is there. And finally, doctor, I was looking into your profile and I've seen that you own and you do a lot of research publications. You do trainings for research publications and journals, and you're also editor for all these research publications and all. Can you tell us more about this?
Down the line, like 5-6 years or 10 years before, you can say, I was very much interested into writing research. So my professors and all, where I did my masters or fellowship and all, they told me कि every thing what you write is quite different from the normal literature. So it is more like research type, or whether we write a review or a case report or something. So I had an interest. So I had to read a lot of articles and I used to write a lot of articles. And then I saw that people in abroad, there is a lot of difference. In India, medical research come into 27th position. It's not very good. So research is very much backlogged here. The reason is, even if we do some kind of case very good, we don't publish it. So how the world is going to know that you have done something and you have to publish it? And I always said that anything which is done in a good manner, or you have find something different, unless and until it is published, it is just a piece of paper and it is waste. And people don't have time. All the doctors are busy in their clinics. Everybody is practicing. So they don't have time. And if they don't have time, they don't have expertise also. Because in our normal curriculum of UG and PG, we are not taught how to do a research and how to write an article and how to publish it.
Correct.
So this gap I found, and then I started this, I hired people, and somehow it became into this level today that we do a lot of research writing, research editing. If suppose you have a case, you want us to help, you will give that case, we will completely format according to a journal, we will guide you how to do, and we will get it published. So in a normal way, we have to submit, review will come, we will help them how a reviews will be answered, how this scenario will happen. And I will take classes for students so that they will also have knowledge how to write an article. And after writing an article, how to get it published. After getting it published, what to do post-publication, so that the world will come to know about your article in your research. And it is very helpful in your growth, in your professional growth. See, one article is published, if you type your name, automatically it pops up in Google. There is no other thing which you can make. You have to pay marketing people to get your name popped up.
Correct, I know.
So it is better. Now you are getting something which is completely related to your profile professionally, academically, clinically. So anything, and they don't know how to do a research also. So I guide them for all these things. Same way, book writing, book publication. We help in getting patents also. So all those things we started in our vicinity. And that is how writing publication is working today.
Okay, so it is exclusive to medical and dental. And
exclusive to medical and dental, healthcare only.
Okay, it's
because
not
the thing is that I have more expertise on this. I have a lot of people who will ask for engineering, law, education background, but I feel that is not my expertise. As I say, कि जो मुझे नहीं आता मैं उसमें हाथ नहीं डालता. So even in these things, I know my expertise is in this, and I have people from all the departments of medical and dental health who are working. So they write best. They help them to write best articles. and then they will help them to put it, they will guide them. So they will do all on the back end, we will guide them. If any questions needs to be answered, we will help them how it needs to be answered so that it will get accepted, and it's like that. So we do with all national, international journals like PubMed, Scopus, Web of Science,
Everything.
NMC, UGC, DCI, all criteria.
Even Nature Nature
Nature
Journal also you do.
Like, see, what happens, no, people don't read the guidelines of the journal. They write something. Usually people will write an article, then they will see a journal and then they will put. No, you see a journal first. See the guidelines of the journal, write the article according to that, and then you put. That is why the rejections are happening. And people don't, 99% of the people, what they do, they will have some case, they will have some research, they will write, and then they will start uploading in journals. Every journal has separate criteria. So you do according to that journal and then you submit, then it will not get rejected.
Correct.
So these all things, gaps which are there, which people don't understand, we help them in these things.
Yeah, I think this is a very important thing, as you said, starting international subject research articles and all, because when I was in UK, I've seen like simple topics they published, like literally there was a paper on how to increase the shelf life of strawberries. And here, that is also a good topic. But again, like here we do so much.
We have
doctors
lot of volume.
do so much of, like as you just mentioned, some cases, the cases which you operated and all. Here, lot of people, lot of doctors do lot of interesting cases and all, rare cases. And all this and everything can be published. There is lack of awareness, there's lack of time, there's lack of interest and all these things. And I feel a lot of people don't know how to publish.
That's the problem. And secondarily, in foreign, there is a funding. So all research are funded. You get time, you get money, you get paid. In India, it's not like that. Even if you want to do some patent or you want to do, we have to put our money. And ICMR and all, when we put also for studies, for grants and all, it takes a lot of time. By the time the interest goes or this so once the government start funding properly and the agencies works in a good manner, then automatically these will increase. And government of India is doing lot of things nowadays for uploading the research, like upbringing the research protocol. Even in NAC and all, previously research was not taken care, but now there is one parallel of research publications are taken care more. Now, even in government jobs, you want to go abroad, you want to get your visa clearance, you want to get a green card, everywhere publications are important. In government in India also, if you want to go for government job, they are asking publication. For promotions, they are asking.
These days medical colleges are asking like associate professor ke liye, even if you have experience, if you want to become associate, you have to have minimum 5 publications or something. 4 publications. So people are like, suddenly from where will I get these publications? Because they don't know. They don't. As you said, in medical college, we are not taught about all these things, how to publish and all. But the thing is, we have data. The very good thing in India is there's data enough to publish a research article. I think regarding this topic, which you're doing, what you're doing is very commendable and all these things. So it's we will do another podcast for this, because it will be helpful for a lot of doctors and students, medical students also. Early days, they can complete at least 2 or 3 publications. So
that's
I think we'll do a part 2, and in that podcast we will only talk about this research publication.
That will be my pleasure.
Thank you, doctor. Thank you for coming to our studio and sharing your knowledge.
Thank you so much for calling. It was really nice, and thank you for you and your team.